Okay, we are recording.
So, hi, thank you, Zane. This is Carmel Sullivan, Deputy Commissioner for Field and Legal Operations with the Department of Early Education and Care. So on behalf of the department, welcome and thank you for participating in today's webinar on differential licensing. The webinar will provide an overview of differential licensing, how EEC, in conjunction with Public Consulting Group, has developed a differential licensing tool for Massachusetts, and how differential licensing will be used by residential and placement licensors. Additionally, the webinar will address how differential licensing will affect you as a provider and how your renewal visits may change in the future. We welcome your questions and will provide you with additional opportunities to learn more about differential licensing in Massachusetts. Thank you.
Thank you, Carmel. So I'm, again, Tina Chenshu from Public Consulting Group. We've been working with EEC for the past few years on the differential licensing model. So today I will talk to you a little bit about what is differential licensing, and then pass it over to Donna, Cohen, Avery to talk about how that will affect you as a provider. So to start off with what is differential licensing? Well, it's a new approach to licensing that looks at a risk assessment-based model that will tailor monitoring visits to provider-specific needs. So we'll talk a little bit about the mission. So this mission that is on the screen was created by licensors here at EEC. They focus on 4 key areas for this new model, this new way of licensing and visiting your programs. So the first key goal and mission of this new model is to promote health and safety at the very core, and then promote as well quality of early education and care programs, which of course includes for EEC residential and placement programs. The model will also increase monitoring, and in those monitoring visits, spend more time tailoring visits to what you need as a provider. So looking at your noncompliance history and also your needs for technical assistance. Also, the new model will support the effective allocation of EEC resources as well as that technical assistance that, again, will be more tailored towards your needs. So differential licensing is also called differential monitoring. This is a model that is used across the nation in many different states. States have used this model to tailor it towards their specific needs, as has the state of Massachusetts. So overall, the model is a method to determine the frequency and or depth of monitoring needed for residential and placement providers. So in that frequency, as the state of Massachusetts has determined that for residential and placement programs as well as child care programs in the state, that the visits will start now moving to annual visits. These are annual monitoring visits. The benefits to you are those that there are going to be increased monitoring visits, again, where the visits will be more tailored towards your needs. And the new model will also include different business processes that will be more efficient for both EEC licensors as well as for you. So you should be able to see those benefits in those monitoring visits. So a little bit of background. The Department of Early Education and Care started down this journey due to a federal change in the Child Care Development Block Grant. That reauthorization occurred in 2014 and required states to visit programs annually on an unannounced basis. So the Child Care Development Block Grant relates to child care programs in the state, but EEC decided that it was an important best practice to visit programs annually and decided to apply this across the board for residential and placement programs as well. So a little bit more about the history of this process. EEC started down this path back in 2013 prior to the reauthorization. And this model was really developed by licensors for licensors. So there were a number of subcommittees set up by unit. So there was a specific EEC residential and placement licensors subcommittee that focused on developing this model for residential and placement programs in this state, ensuring that the new model would be tailored towards the state's needs, towards your needs. So back in 2013, subcommittees started to meet on their own. In the spring and summer of 2014, Public Consulting Group, which is an international consulting firm focused on government consulting, we were contracted to work with the subcommittees to help bring in national research, develop a model, and also develop a plan to see if that model will work in the state. Additionally, EEC received technical assistance from the Office of Child Care's National Center on Child Care Quality Improvement. We also conducted national best practices, including different state interviews of different states who have completed this type of program and redesign in the past, and also states that are embarking on the same process for the future. And then in fall 2014, the model was created, and then EEC piloted the model across all program types. So those of you who are on the phone who participated in that pilot, thank you so much for your time. In that pilot, we not only received feedback from licensors who were out in the field, but also reached out to residential and placement programs who received the pilot to understand how that visit went for them, how that new model works for them. So we took all that feedback, and then in January through April 2015, revised the model, and then created a new and improved model, which we then piloted again out in the field in May and June of 2015. Feedback was also collected in a similar fashion to ensure that this new model would work not only for the licensing staff themselves, but also residential placement programs. And then fall of 2015, business processes were finalized and staff were trained. That brings us to 2016. We're embarking on full implementation, and full implementation will occur in early fall, in the next few months. So you'll see on the top of this timeline, there's also IT system redesign. So while EEC licensors were hard at work creating a new model, piloting, getting your feedback, there was also a redesign of the IT system that supported all licensing processes. EEC contracted with a company called Encapsulate to build a new IT system that was paired with the purchase of iPads to increase efficiency for licensors when they're out in the field. The goal is that the increased efficiencies in the field for licensors will translate to increased efficiencies for you as a provider. Okay. So a little bit more about what is differential licensing in the state of Massachusetts for residential and placement providers. So at the very core of this model are annual provider visits. So all licensors will visit providers on an annual, unannounced basis for family and center-based care. For residential and placement, you will also see unannounced as well as semi-announced visits to your programs annually. So the core are annual provider visits. To accompany that are revised business processes that include more efficient visits for you. So that includes additional tools that licensors will use while they're out in the field. Layered on top of that is a new IT system, which is called LEAD, and that includes the use of iPads in the field. So you'll begin to see that in the next few months. Or you may have already seen the use of iPads today in your visits. So the core annual provider visits, there are new policies and procedures to help efficiency to get to annual visits. There's a new technology system that incorporates all of those policies. And that entire 3 sets of things encompasses all of differential licensing in the model. Okay. So differential licensing will help promote provider compliance through workforce development. We talked a little bit about how these new visits will increase time for then increased technical assistance that are more tailored. So EEC licensors and the department were really interested in using this model to create a partnership between licensors and providers. So if you remember, the mission is very core to this model. You'll begin to see with the rollout of these new processes more time and more attention to building that partnership. With the new business processes and the IT system, you'll also see increased efficiency on the administration side. This will begin to look differently for you as well, as the model allows for procedures for you to submit compliance documentation electronically. So you see that rolling out. Some of you may have already seen that today. You'll also see increased monitoring effectiveness through risk-based assessment. So licensors will now conduct a thorough review of compliance history and review indicators of risk to inform how they will review your program on their annual monitoring visit. And the last thing here is promoting quality. So with the new model, licensors and EEC want to focus on ensuring that when they're out in the field, they're helping you promote quality. Okay, I'll pause here and remind you that if you have any questions or comments, to please use the chat box on your WebEx screen under participants. We'll take questions as we go, and then we'll spend some time at the end of this webinar to answer your questions. Okay, so differential licensing is more than just annual visits. We know that annual visits will take some time, so full implementation of differential licensing will begin this fall, but the phasing out over time it'll take some time for licensors to actually visit annually. So please know that as with any model and you change, it may take some time. So other improvements from licensing today, EEC licenses will now tailor their visits to provider-specific history of noncompliance. The new IT system will help with that. It will make it easier for licensors to pull information about you to tailor visits. Again, we'll have more time for technical assistance. Built into the new model are also procedures for recognizing best practices of health, safety, and quality that you may already be performing. So overall, that may look like shorter visits for those providers who are in compliance, and also more targeted future visits. All right, so now I'm going to pass it over to Donna Cohen Avery, the Associate Commissioner for Field Operations Policy, to talk about how this new model will affect you.
Hi, everybody. I'm Donna Cohen Avery. I am also the Regional Director in the Worcester Regional Office. So in addition to this role that I have for the state, I sit in a regional office with licensors, and I'm well acquainted with their experiences in the field. Not as well acquainted with residential and placement, however, so let me just put that out there as a caveat. You may have some questions that I can't answer on this webinar, but we will get back to you with answers. Essentially, there are many benefits for you as providers in addition to the benefits that we will experience at EEC. You know in residential and placements that some of your renewal visits or other visits can be a multiple-day event. And these focus visits are not intended to be that. They're intended to be much more honed-down visits that focus on key indicators of areas where children would be at imminent risk. So when we come out to do those visits, and they will be either unannounced or semi-announced, our intention is not to be there for multiple days, but to be there maybe for a couple of hours or a half a day at most to conduct those visits. There will also be multiple types of visits that licensors will be conducting, various and sundry lengths of visits. There will be monitoring visits, there will be, sorry, I get distracted by something in the room. There will be enhanced monitoring visits, which might be a slightly deeper look into something, and then there will be the visits that you're acquainted with today, which go over the full set of regulations and are very comprehensive. There will always be a revisit back to the more comprehensive visit over a period of time, and that period of time will be determined by your compliance history. So if you're a program that is in substantial compliance the majority of the time, then you will have more of the focus type of visits than another program that is perhaps struggling with some of the regulatory requirements and is having a harder time meeting the regulations. We will hope to have more time based on shorter visits to do technical assistance with programs, to be able to answer questions, to be able to observe in a way that's helpful to programs as opposed to simply observing to assess whether or not you're compliant with requirements. And we're really looking forward to that ability from a licensing point of view to be able to spend that kind of time in programs and to be able to, as Tina said earlier, work in partnership with the programs that we license. We see this as a very proactive approach, and I know you heard the term monitoring earlier, and I know for residential and placement monitoring can sometimes have a negative connotation, but we're really hoping to change that point of view, and that both EEC and providers will begin to view those monitoring visits as positive. Our ability for us to come in and out of your program fairly quickly, to do a quick assessment, to be able to say, we think things look good here, and move on and let you go about doing the important business that you do with children every day, so that our visits can be less intrusive into your program and more helpful in terms of us determining compliance and you being able to do the important work that you do. So I mentioned a little bit about this already. The visits will be semi-announced for residential and placement, and the reason we're saying it that way is because some visits will be announced and some visits may be unannounced. In situations where we know the complement of children in a program would be adversely affected by us coming in unannounced, we will definitely plan with the program a window of time during which we would visit so that you can get the children ready, get your staff ready for a visit. But there will be situations where we will come in unannounced, as we do on some of our investigation visits now, but with a whole different focus, with a focus of finding just the key indicator elements and taking a look at those and just making a quick assessment of your program and moving on. These are compliance-driven visits, and the whole idea here is that if your program does well, stays in compliance, then although you will see us annually, the interaction that you have with us will be hopefully a very positive one, and this is with an eye toward prevention and our ability to have a more frequent relationship with you so that we can have conversations about what's happening in the program on a regular basis and not just when we're getting around to a renewal visit once every 2 years or some kind of licensing process activity or an incident that you've reported that we need to respond to. We're really looking to be able to engage with you for a positive reason in a positive way moving forward through this model. So do you have any questions of us? And we're looking in the chat box. What do we see, Tina?
So I'll take this here. We've received so far a few questions. The first one being whether the actual PDF or slideshow of this call will be available publicly. We are recording it, and it will be, the recording of the webinar will be posted publicly, but whether the PDF of the presentation is going to be made public.
I don't see why it couldn't be. We actually hadn't had that conversation because of the fact that we were publishing the actual webinar, but we have someone else from EEC who I'm looking at to see if that would be an okay thing to do in the room. Kathleen Hart, our communications director.
Yeah, I think that's fine. We just have to make it web accessible first. So there might be a slight delay in posting it, but I think we can.
Kathleen, could you say that one?
Yeah.
I'm sorry.
I don't see any reason why we can't post it. We would just need to make the document web accessible before we post it, so there might be a slight delay in getting it up online.
Okay. I think there's your answer. Okay, we've got some questions coming in now. So the first one that I have here is there a basic outline of areas that will be covered in shorter visits, or is this just going to be tailored completely to the provider's needs?
There is a basic outline. I'm actually pulling up the residential and placement key indicator list right now. We are covering a handful of domains on these visits. I'll go over the domains because I think they're easier to discuss than the nitty-gritty of the actual key indicators. But the domains are care of children, behavior support, physical plant, and records for residential. And I'll give you the example of records. It's not every record, but a handful, a communication log, accurate medication log, and review of incident reports. That's one example of some of the key indicators under a domain area. And then for placement, adoption agency key indicator domains are executive administration, adoptive parent records, birth parent records, adoptive child records, and then foster care agency key indicator domains are executive administration, foster parent records, and foster child records. I don't know if that answers the question.
I just want to point out that as a reminder that these are a subset of current regulations, so there's nothing new with these tools.
Thank you.
It's a subset of key indicators from the larger list.
Yes. So where it would be more specific to your program would be if we were looking at, let's go to care of children under the residential key indicators. The key indicators for that are adequate staffing, appropriate supervision, daily routine and structured activities, and administrator or designee on shift. So if in one of those key indicators of risk we saw something that was a potential noncompliance, we might look a little deeper in that area, and that's where the tool would be more in line with what was actually happening at your program at the time. We wouldn't look at every detail of all of those areas, only the places where your program was having a noncompliance issue. On the flip side of that, if your program was engaging in some type of a best practice related to one of those issues, we would acknowledge that within the documentation that you'll be receiving, and we'd be able to talk with you about how you've been able to achieve that success at your program, so that that's information that we can then use in visits that we do elsewhere.
To follow that up, I had a follow-up question come in here. Will there be a document made available that lists these key indicators?
We haven't talked about that internally yet, but we have always at EEC listed all of what we expect on any kind of our visit and made it public, so this will not be an exception. Once we have all of that in an easy-to-follow format, we will certainly be able to publish it for providers to know, but as Tina mentioned a second ago, none of this is different from what we already do. It's a subset of the current tools that EEC uses to do our visits, and those should be available on our website. What I don't know, I'm questioning here if they're available for residential and placement at this time. I know they are for group and school age and for family child care, because I think residential literally looks at the entire set of regulations, so they may not be using an actual tool. So the answer to the question is yes, we'll make it public to you.
We also mentioned that we'll be rolling out differential licensing over the course of the next few months this fall. So as different pieces are rolled out, particularly the new IT systems, we'll be in communication with the provider community.
Yes.
To follow that up, I have a question about renewals. The question was, if we have programs whose EC licensing is expiring in November, December, and January, should we expect the past 2-day licensing or the new differential licensing model?
That's a really good question, and it's actually something we are still figuring out how to actually roll this out to the existing group of providers, because if we start with everybody at that 2-year cycle with a full visit, then we aren't really able to fully implement this model. So we're going to have to figure out, probably based on compliance history, who we start with the modified visits and who actually has the full, I'm going to say 2-day, but it could be more than that or less than that depending on the size of your program, renewal studies. And your licensor would be communicating that with you in advance. I don't think we're going to be doing, I think for residential and placement, our renewal visits will be announced, or at least semi-announced. It would be the in-between visits that would potentially be unannounced.
Talking a little bit more about the visits, first off, going down the list that I have here, question about the visits and preparing for the visits. Someone asked about their checklist that they submit for renewal currently. Should that just be updated and kept at the program, or will that need to be submitted at some point?
I believe that it still will need to be submitted as part of the renewal process, but again, I'm not as familiar with the RMP day-to-day business practices to know if they've made a change to that based on differential licensing or if they're expecting you to submit it. That would be part of your renewal packet.
Okay. So your licensor will be in communication.
Yeah, the licensor will let you know as those decisions happen.
Can you clarify a little bit more about the difference between what we mean by semi-announced? There's a little bit of confusion on what the difference is between that and unannounced visits.
I'm actually going to defer to Tina on that because I think you have a better idea of what residential placements discussed there than I do.
Sure. So as Donna mentioned earlier, when we say semi-announced, it could mean that your program has an unannounced or has some notice, and the notice would really be for programs that have populations of children where that's necessary. So if you have semi-announced, it's up to licensor's discretion, program by program basis, then you would be given a time frame, a window of time, a week's window, to know when a licensor will come visit and monitor your program.
Yeah. There could be a lot of reasons why we decide to make it a semi-announced visit. It might be that we need particular people available, and we understand that that may not be the case if we come by unannounced, but those people may not be available for us to observe or meet with or talk with otherwise. So that would be another reason for semi-announced in addition to the complement of children in the program.
Okay. I have some more visit questions. Currently, a licensing visit includes a lot of pre-work on the part of the provider, including assembling a list of documents and a self-study of staff files and patient, in parentheses, resident files. I assume that this will no longer be a part of licensing visits, is the question.
So the processes that were described in that question were related to the 2-year renewal of your license.
Yes.
At this point in time, those processes will remain the same when you're renewing your license. However, the in-between visits will not require the same amount of pre-work.
Okay. Another question I have here.
Sorry. If you think about the renewal process as separate from the visit, many of those items are part of the renewal process, and it was, in some cases, easier to look at some of those things on a visit, or it's just that all those things happen at the same time, the visit and the renewal process. So it became, people thought of it as part of the visit, but it's really part of the renewal process itself. Sorry, Zane, go ahead.
Oh, it's all good. Next question on the visits. What about the checklist that's submitted for renewal? Nope, I'm sorry, I'm looking at the wrong one. What happens in an unannounced visit if key staff members are away or cannot meet with licensors when they visit?
We would not be able to assess those items. So it would not be, there would be no assessment, so there would be no finding of compliance or noncompliance or what have you. If we're not looking at it, we're not assessing it. So in other words, it's not any kind of a negative impact on the program. If we come unannounced and somebody who we might want to meet with but isn't required to be at the program during the point of time that we come there, it's not an issue as far as the program is concerned. You don't need to worry that there would be a problem with compliance based on the fact that somebody was at a meeting who has every authority to leave that program and go to a meeting. We expect that there'll be some of that. In fact, we're expecting in some of the other kinds of programs we may even find no one there when we come.
So 2 questions in one here. The main question is really, are renewal visits announced? And going along with that, will there, so do we still submit a renewal yearly and then have unannounced visits as well?
No, the renewal is still every other year, so it's once every 2 years. And I know in residential placement there are some circumstances in which a renewal is a 3-year renewal, and if you're a program that has that, you know who you are and you know what the circumstances are. But we will not be moving the renewal process to annually. That would create a lot of that would not create efficiencies for us. That would just make the process more cumbersome, or for you. So whereas the regulations require 2-year renewals, we'll still continue to do that, but our visits themselves will happen more frequently.
And so on top of that, there is being added annual unannounced / semi-announced visits is the follow-up question there.
Yes. With the hope that those visits will show us that a program is in compliance, and then we will have the option to do some renewal visits that are also more focused and don't include the same amount of items that we look at today. If we're there more frequently, we don't need to look at everything every time we come. That's the hope.
Again, talking about visits, what's the time frame which visits would likely occur? For instance, anywhere between 9 to 5 or after 3 o'clock? Can providers expect visits going to evenings, and especially considering school schedules?
I don't see us doing visits in the evenings unless that's something that's really indicated by how the program operates and what the need of us doing an unannounced monitoring visit might be. But it'll be pretty much during EEC's business hours. And I don't think, I'm looking at Tina, because I don't think the residential and placement team, because their whole team has been part of this discussion, talked about night or weekend visits.
At this point, nothing will change in terms of timing.
Okay, that's my understanding as well. So EEC's normal business hours are 8:45 to 5. Some licensors have flexible schedules, so they work a little bit earlier, a little bit later, and they're arranging program visits based on what makes sense for that program to the degree that they can within those hours.
Okay. I have one more question so far, and we're going back to key indicators here. Are the key indicators determined on an organization level, or are they program specific? And how does it work with an organization that has multiple licensed programs?
They are program specific. So we are looking at each individual facility program as it were, and looking at the key indicators there.
Okay. That is all the questions that I have received. And I don't have anybody flooding to, let's see here. I missed any. So just to clarify, can you define executive administration?
The key indicators under executive administration for placement providers are change in program or leadership and reviewing annual evaluations.
Okay. along with that?
It's most likely a domain that lines up with the regulations themselves. That's probably where the term comes from.
Okay. Another question here. Can you give adoption agencies a checklist of what you'll be looking for?
We can certainly give you what the key indicators are, but as we've discussed throughout the webinar, it's not a hard and fast list. So we have the key indicators, and based on what the licensor is seeing or questions that you're asking during a visit may determine what else we decide to look at beyond what's on that tool.
And the purpose of that, from the licensor's perspective, was really to ensure that visits are tailored towards your compliance history and towards your needs.
Yes. Additionally, what we don't want to do is create a situation where we're essentially doing the same thing every time we come out, so people are arranging their program in a way to pass the test, so to speak. We want to make sure that it's a true look at your program. So there will be some random items that get put on each of these monitoring tools when a licensure comes out that even the licensor doesn't know what those random items are going to be when that tool is created by our new IT system. So while we can give you the list, and this is why I'm hesitating, we can't promise you that it's only going to be these 8 things. It could be 8 things and 2 more random things, or it could be 8 things and the licensor wants to look deeper into an area where there's something that needs to be looked at further.
Okay. Does anybody else have any other questions? You can send them my way. Can you clarify which staff have to be present?
Whoever is at the program at the time, who's required by the staff schedule to be there, are the staff that have to be present. Or should I say by the regulations?
Okay.
And if it's beyond that, the licensor may make a decision to do it either semi-announced or announced.
Okay. If there are any other questions, we'll give another couple seconds here. That is all I have right now.
Okay.
There is one more. If
okay.
there is an unannounced, if there is an couple more. Okay. Hold on. If there is an unannounced visit at one of the programs in the agency, should it be expected that there will be at the other programs in the agency as well?
Not necessarily, and most likely no.
Okay. For a residential school, students spend the day at school, so no staff would be present in the group home. Would the licensor contact a senior administrator?
I think a licensor would likely, if there were no children there, would not take that time to go for an unannounced monitoring visit because there would be nothing for us to see unless we wanted to look at particular administrative things, and in that case we would most likely make an appointment. I don't know if I understood that question correctly.
I think that addressed it. If there are no students at the group home, nope, yep, that confirmed it. That was correct. And I'm not receiving any, one more. Should we expect unannounced or semi-announced checks for the review of youth files and personnel files?
I'm going to actually look at the key indicators really quickly to see. We really tried in these visits to get away from, in the basic monitoring visit to get away from record review because it does take a lot of time. So for the most part, there isn't a lot of record review in the basic monitoring visit. There would be a little bit in an enhanced monitoring visit, which could also occur at a renewal time. And definitely in a full licensing study would be what you're used to today, where we did a very full review of everything, including records. But I'm not saying a hard and fast no, because there could be something that indicates to us that we want to look at a particular record or need to look at records.
And follow up to that, so we will continue both the 2-year and 2-day full renewal license process and annual unannounced/semi-announced visits.
The answer to that question is yes and no. So you will have some renewal visits that are the full visit you're used to now at that 2-year mark. There will also be some renewal visits that are not the full visits that you're used to now. That will be a modified visit that we're calling the enhanced monitoring visit. And Tina, are there ever in residential times where it's the monitoring visit at a renewal cycle? There is. So all 3 of the new tools could be done at a renewal cycle in addition to what you're used to right now.
And it's all based on your compliance history?
Correct.
And the risk-based assessment, which is on the key indicators themselves?
Yes. And do you know the point at which in residential and placement, you're looking at me like you know what I'm going to ask, where we would go back and do a full again if we hadn't for several years? We don't. Yeah, some of the feedback that we got from other states when we were embarking down this road was that they learned that they really felt that it was important that at some point in time that we revisited a full tool with programs, because they were learning that what was happening is some regulatory compliance was falling by the wayside because those agencies were not looking at those things any longer. So it is the intention in all of the licensing for us to go back at points in time and relook at everything. But again, in residential and placement, you'd be notified, and that would be a full visit because we understand what you have to prepare in order for that to happen. And you can't possibly do that if it's unannounced.
So will the license still have an issue and end date?
Yes.
So your visit type will be affected by your compliance history. Your full review will happen periodically, but it may happen more often based on your compliance history.
Yes.
So the reason why it's difficult to understand is because it's really driven on the program's history.
Correct.
I think you partially answered that question with this last, your last statement there, but so do we still follow, do we follow the relicensing schedule for renewal packets and licensing fees?
Yes. Yes, nothing with that has changed, because we still need to collect all of the material and make an assessment about the renewal itself in addition to whatever type of visit we choose to do at that point in time.
So to answer a previous question, every 4 years at minimum is when you will see the same tool that you see today, which is the full checklist.
Right. And these are some policy decisions that were made by the groups meeting. It may be as we roll the model out that some of that gets modified to be either more frequent or less frequent. I doubt very seriously it will be more frequent. If anything, we might modify to be less frequent if we find that the tools are really doing what we hope they do and we're learning what we need to learn and feeling confident that we're making a good assessment of programs. It's going to be a learning curve for all of us.
That's a really great point, that this is a new model. We've, as I mentioned earlier, looked at national best practices, specifically spoke to states with similar situations, ones that have been doing this same model for years, also states who have just started embarking on it, just like Massachusetts. So it's a learning process, not only in Massachusetts, but across the nation. So EEC will be in communication with providers as things change, as policies are set in stone.
And I think what we didn't say when we were going through the PowerPoint, but it's probably important to say now, is that the feedback we got from the pilots from residential and placement providers was really extremely positive of what those monitoring visits were like and what that experience was like from the program's perspective.
Well, talking about those visits, clarifying question, if a visit is announced, will you tell us what type it is, basic, enhanced, or full?
So unfortunately, licensors cannot, because if they walk in intending for a short visit, but there are some circumstances at the program that require deeper review, it may become a different type of visit. So again, everything is tailored based on the provider, the program's compliance history, and current compliance.
I think to clarify that even a little bit more, these are not visits that there's small, medium, large. There's a lot of room in the middle of each of those to tailor to the specific situation that we walk into. So for example, if we were doing the enhanced monitoring visit at a point in time at a program and we discovered some things that we decided we wanted to look a little deeper at, it doesn't mean we automatically go to the full multi-day review that you're used to now. We can simply look at those things a little deeper, maybe come back and do a follow-up visit, or modify that however we need to get at what we're trying to achieve in that visit, which is compliance. We don't need to just automatically leap from one visit type to the next visit type. The system will predict to us what it is that the licensor should be doing based on what the system says, but the licensor does have the ability to override that. For example, if the system is predicting an enhanced visit, but we were just there to do an incident review with somebody, we may not do the enhanced visit. We may simply do the monitoring visit because we were literally just at the program and it's not warranted that we do the more in-depth checklist. I say checklist, I mean tool. Because they're definitely not checklists, and I think that's what makes it a hard conversation, because it really requires a lot of thinking on the part of the licensor to make good decisions about what needs to happen at each individual visit. So it's not like we can just post 3 checklists and call it a day. It really is a living process that will be determined by what we see when we go out into the program.
So, follow-up question, what comprises history? CAPs, 501As is the question.
All of the items on the current checklist that you see today will be included in the compliance history. So any record of your past reviews or incidents.
Right, and it's not that you had an incident or a 51A or 51B at a program. It's what we found as a result or what your internal investigation noted. It's what the compliances were, what the non-compliances were. That's the history, not an event, but more what came from that event, if that's helpful.
Okay. Just to point out, we had a comment here that said the participant was part of the differential licensing pilot, and she says that staff found it to be kind of stressful initially, but overall positive once completed. And to follow that up, another question here. Are we going to have access to the tool EEC will use when they come for their visits?
I've answered that a number of different ways throughout the conversation. I'm going to give it one more try. The answer is yes and no. We will tell you what the key indicators are that we're looking at and what the domain areas are. But just because we have that list doesn't mean that either is all we're going to look at or that we're even going to look at everything. We may, in the middle of an enhanced monitoring tool, decide that we can move to the more focused visit. We may, on a full 2-year announced renewal visit, decide that we can move to the enhanced monitoring tool and look at less based on what we're seeing. So we will certainly share what the key indicators are and what the domains are and maybe perhaps what some of the areas, well, you know from the regulations what some of the areas are that we might put in there randomly, but no two visits will look exactly the same. So we won't come in and hand you the tool and say, here's what we're looking at today, but we're certainly not going to walk in there with the intent of catching people doing anything that they shouldn't be doing. Or the whole idea is to see the program as it's really operating so we can give you the best possible assistance in terms of compliance with the regulations. That's the goal. We're looking to work with programs alongside of you, not to be we're using the term monitor, and I know that that can have a negative connotation, but we're not looking to monitor you. We're looking to work with you.
Okay. Well, we're getting close to the end of our call here, and I haven't received any, well.
Every time you say that, Zane, you have another question.
I know, it's bringing it on. In response, someone did, to the last comment, someone did note that it doesn't terribly feel that way.
I think it's the unannounced piece. I know that that can be really unsettling to people because it's very new for residential and placement, because the only time we come unannounced is when there's a problem. And, even in some of the other types of things that we license, that's very much the case. And we're really looking to shift the thinking on that internally at EEC as well as with providers. But I certainly understand why folks would feel that way when you're not used to. Just like if someone dropped by my house unannounced and knocked on the door on a Sunday afternoon, I might have appreciated a call first. So I totally appreciate that. But this is a national best practice. There is a good deal of research behind the unannounced model, and it's very positive in terms of what it yields for states that are doing it.
So what may be one of our last questions here. So with the monitoring visits, is there a possibility it could result in citations?
Yes. Yes, any visit could result in citations because we're looking at regulations, and if we find a non-compliance, we will definitely have to cite it.
So we are right at 2 p.m. right now. I think, Zane, if there are any additional questions, we'll make sure to post them after this webinar, along with the other materials, including the recording. All right. Well, we want to thank everyone on the call. We're really pleased to see so many people call in and take so much time out of your day. We appreciate your time, and please look for the documentation that we've talked about today, as well as further communication as EEC rolls out differential licensing over the next few months.
Thank you very much. We really appreciate your participation.
All right. Have a great day.
Thank you.